So this is a question I get a lot. Some people will say that when you give a transfusion, a red cell transfusion, you're giving IV iron. And that is misleading. So yes, there is iron in red cells. So when you give a transfusion, the patient is receiving iron, but the iron is inside the red cell in hemoglobin. So it's not going to be there to generate new red cells. It's there within the red cells that you're given. And so briefly, I just want to show you that in the mature red cells, say you deliver this transfusion of iron, you have these mature red cells. After they've reached their life cycle, they will break down and the iron will be broken down and then exported and then recycled. So iron is really efficiently recycled from red cells because our body doesn't want to have to rely on a lot of external iron to continue to maintain that hemoglobin. So when you get this iron recycled, you make new red cells, new reticulocytes, and they become mature. So any transfused red cells you get will maintain, you get to a certain hemoglobin, maybe you went from a 6 to an 8. That iron will maintain you at a hemoglobin of 8, but it won't become available and make new red cells, okay? So to continue to improve the hemoglobin, you need to start iron therapy after the transfusion. The transfusion stabilizes a patient, and then you need more iron to get that hemoglobin all the way up and then to replenish your iron stores. It's different when you think about oncology patients or other patients that are dependent on red cell transfusions who are not losing blood. In those patients, you're giving loads of iron, and they may already have iron in their body, they just can't use it effectively. But in this setting, our patients do not have iron. They don't have the supply they need to make new red cells, so you have to continue to give them that. The other question I get with transfusion therapy is it okay to give a transfusion and IV iron close together? The answer is yes, you can. The caveat I would say is that because both red cell transfusions and IV iron infusions do have the potential for infusion-related reactions, I would advise trying to separate them by some period of time so that you're not unclear as to whether the patient is having a reaction to the blood product or having a hypersensitivity reaction to the iron itself. And so if you had to choose between the two, you need to stabilize the patient and give the red cell transfusion, make sure they stay stable. If they're being admitted, then wait till the next day and then potentially give IV iron at that time. But yes, you can give them, you just don't want them to be directly overlapped because you want to be able to distinguish on the off chance that someone has a reaction.